more than 50% of the personal care homes in the province are in outbreak. And COVID doesn't really care who you are or where you live. It will attack anywhere.
Personal care homes across the city are currently battling COVID-19 outbreaks, setting a reminder to all that COVID is far from over for those vulnerable in the community. According to the Winnipeg Regional Health Authority, there are outbreaks at 17 senior residences in the city. WRHA spokeswoman Bobby Jo Stanley says there are staff on site who are monitoring the outbreaks and processes are in place if staff transfers from other WRHA facilities are needed.
So I think the homes are doing everything they can. We've certainly learned a lot about COVID-19 since the beginning. We have, as I mentioned, we have the vaccines now, we have treatments, but we also know how seniors react to COVID-19, and we know to watch for things like hydration and to initiate that very quickly when we see that the seniors are suffering.
Maple's personal care home is among those with active cases of COVID-19. As of Sunday, 17 residents were affected, along with 10 staff members. During the second wave of the pandemic in 2020, Maple suffered one of the deadliest outbreaks of COVID-19.
There's COVID in Maples because the visitors, possibly the staff, are carrying it in there. And just because we've been vaccinated 2 and 3 times doesn't mean we're COVID-free. And that's the ugliness of COVID.
Maples is not the only personal care home of concern. Jan Lagueros with the Long-Term and Continuing Care Association of Manitoba says more than 50% of personal care homes in the province are grappling with outbreaks. But the good news is, compared to the start of the pandemic, care homes are more prepared and equipped to handle COVID-19 outbreaks.
All of the regional health authorities have a system in place to communicate with their personal care homes who are in outbreak. And if they require assistance, if they have a number of staff off sick, for example, there are resources available to them to come in and give them a hand. So, fortunately, this time around, we're not seeing a lot of staff illnesses.
Lagueros says about 98% of care home residents are vaccinated, and about 25% of care homes have a policy where all staff must be vaccinated as well.
Well, right now what's going on is the 4th dose is being given to all personal care home residents that want it. And as well, it's being offered to all seniors in all congregate settings.
In Winnipeg, Brianna Marcello, City News.